Hi everyone, this is an anatomy and physiology video for healthcare students. In this video, we'll be talking about endocrine system, thyroid and parathyroid glands. So let's first of all talk about the location of the thyroid gland. The thyroid gland is wrapped around the trachea. It is shaped like a bow tie with a right and left lobe, and it has a isthmus, a little narrowed portion here that is sitting right anterior on the trachea. On the posterior side, there are 4 little nodules. These tissue pieces are parathyroid glands. So in looking at the thyroid gland, there are thyroid follicles and parafollicle cells. Each type of cell makes a different class of hormone. So follicle cells make T4 and T3. T4 is thyroxine. The 4 comes from 4 iodine atoms. T3, 3 iodine atoms, is also known as triiodothyronine. All right, so the thyroid parafollicles make a different type of hormone altogether. That type of hormone is called calcitonin. It is a calcium regulating hormone. So we're looking at the thyroid gland. This is a section through the gland. First, let's locate the follicle cells. The follicle cells surround the colloid. Now, the parafollicle cells are in the background. They do not surround the colloid. And that's because the follicle cells make thyroid hormones, T4 and T3, that are stored in the colloid. So the colloid here looks like a lake from an aerial view, and that's where we store thyroid hormones for about a month's time. So, if there's any quick demand or quick need for more thyroid hormone to help us regulate metabolism, we have an instantly available supply in that colloid. We don't have to wait for the body to make more, and it shouldn't be immediately dependent on how much iodine we have available in the human body. So to take a step back and think about how the thyroid gland knows to make its thyroid hormones, the control actually originates in the hypothalamus. So the hypothalamus ultimately controls how much thyroid hormone is made, and it's by a negative feedback loop that originates with thyroid releasing hormone or thyrotropin releasing hormone coming from the hypothalamus. It's called TRH. This releasing hormone targets cells in the anterior pituitary. In turn, the anterior pituitary makes and releases thyroid stimulating hormone, or TSH. TSH targets the thyroid follicle cells, and they now release thyroxine and triiodothyronine. Those are T4 and T3. T3, by the way, is a more potent form of thyroid hormone. It's just a less common form. It's usually made at the conversion of T4 into T3 at the site of cells and tissues. Let's now switch gears. Let's talk about parafollicle cells. Parafollicle cells make a different type of hormone. This hormone is called calcitonin. So calcitonin is only made in response to changing blood calcium levels. In fact, if blood calcium levels are too high, they can be dangerous for us. So high levels of blood calcium will activate the thyroid gland follicles to make and release calcitonin. Like all hormones, calcitonin travels the bloodstream. Calcitonin targets the bones to activate osteoblast. Osteoblast will in turn deposit blood calcium into new bone tissue. That removes the excess calcium out of the bloodstream. Parathyroid glands, around 4 to 8 little nodules of tissue. They are located on the posterior side of the thyroid. If a person has a thyroidectomy, they have to be careful not to also remove the parathyroid glands. Then you'd be left with no way to manage your calcium levels. So let's talk about parathyroid hormone control of calcium levels. So again, this is humoral control. The hormone parathyroid hormone raises blood calcium levels. It does so by activating osteoclast. Those are bone-destroying cells. They will then break down bone tissue and release calcium into the bloodstream. PTH also targets kidneys to reclaim calcium from forming urine. PTH also targets the small intestine to claim calcium out of the foods that are passing through. So these three target organs, bones, kidneys, and small intestine, all help to increase blood calcium levels. So blood calcium regulation is operating under negative feedback control. This is humoral control. It helps us to maintain proper blood calcium levels. So in excess, we'll deposit that blood calcium into the bones by having calcitonin activate osteoblast. If the opposite is true, if blood calcium levels are too low, then now we see PTH release calcium from the bones, or we reclaim it from forming urine, or we can grab it from food passing through our digestive tract. That way we can maintain blood calcium levels and pull those back into line. So it's kind of a seesaw effect. We're looking for a way to maintain blood calcium using these two antagonistic hormones. They will help us to maintain normal blood calcium levels. So just an opportunity here for you to think about what we've discussed. So the hormones released by the thyroid parafollicle is actually only one. It's calcitonin. So what hormone works against the actions of calcitonin? That's right, it's PTH. So PTH and calcitonin are antagonistic. They do opposite jobs in maintaining normal blood calcium levels. What hormones are released by the thyroid follicles? There's two of them. Thyroxine is T4. 4 stands for the number of iodine atoms. And T3. 3, of course, 3 iodine atoms. Interesting little history tidbit. The reason that we have the choice of iodized versus non-iodized salt in the grocery store comes from Midwestern states have low iodine levels, and many people experienced goiters about 100 or so years ago. So iodizing the salt was an easy way to make sure everybody got enough in their diet and could help us avoid goiters. So in summary, we've got the thyroid and parathyroid glands. Both are found around the trachea. Parathyroids are found as little nodules on the back side of that thyroid gland. Well, if you have any questions, you're welcome to leave them for me in the comments section. I hope you enjoyed this video. If you did, please like my video and follow this channel.